Hi, Miss Clancy. I came in to do your discharge teaching before you leave. You ready?
Yep, I'm ready.
Okay. So for your diet, you're going to want to maintain adequate nutrition that's good for you and your body to heal. You should eat foods that are high in fiber, including bran, broccoli, cauliflower, and fruits to help your bowel movements become more regular. Eat foods that are rich in calcium, including dark leafy vegetables, milk, and yogurt. You should drink plenty of water and non-sugar supplemented juices each day to satisfy your thirst and maintain hydration. You should avoid soft drinks, coffee, tea, and alcoholic beverages. You should gradually increase your activities until you're back to your normal routine. Rest frequently. Don't do any heavy lifting, pushing, or pulling for the first 2 to 6 weeks or as instructed by your physician. Do not drive until you're released by your physician. For your breast care, your breasts and nipples may have changed and or grown during your pregnancy. Wearing a well-fitted supportive bra day and night may be more comfortable as your body adjusts to these changes. Wear breast pads until your breasts stop leaking. This leaking may occur for several weeks to months. You can apply ice packs between feedings to ease discomfort. If you're not breastfeeding, you should wear a well-fitted supportive bra for at least 3 to 4 days following delivery. Refrain from stimulating the breasts and nipples. Do not pump breast milk or permit the newborn to suckle to alleviate engorgement. You should apply cold compresses in the form of a wet towel, cold packs or ice packs for 15 minutes at a time or every hour as needed. To prevent tissue injury, do not apply cold directly to the bare skin. Do not massage or apply heat to the breasts. If you will be breastfeeding, your baby's mouth should form a tight seal. The lip should be against the areola, not the nipple. If the baby is suckling incorrectly, slide a finger between your baby's lips and your breast to break the suction gently. Reposition and try again. You should nurse as long as your baby wants, usually between 10 and 30 minutes. At first, your newborn will probably want to nurse many times in a 24-hour period, but not for very long. It's important for the health of your breast to have your infant feed from both breasts every feeding. Some good signs of nursing are hearing your baby swallow without a clicking sound, seeing movement in the baby's ears, and not seeing dimples in your baby's cheeks. You and your baby should appear calm and relaxed during the feeding. You should feel gentle tugging at the nipple, but no pain. If you do feel pain, it may mean the baby is not positioned properly or that the tongue does not extend past the lower jaw. Remove the baby and begin again. For your personal hygiene, you should wash your hands frequently as you care for yourself. To prevent infection, always wipe front to back after going to the toilet and clean your bottom with warm tap water using the Perry bottle after you urinate or have a bowel movement, and you can pat it to dry. It's important to change your pads frequently every time you use the bathroom. Your vaginal bleeding will decrease in amount from bright red to pinkish or brown to a yellow or cream color. Your menstrual period may occur as early as 6 weeks to 2 months after the birth of your baby. You should avoid constipation by taking a mild laxative or stool softener until your bowel movements have returned to your normal pattern. You should increase your fluid and fiber in your diet to help regulate your bowel movements. Discuss birth control options with your healthcare provider. You may choose to obtain a method of birth control before resuming sexual intercourse. Nothing should go into the vagina for the first 6 weeks after discharge. Sexual intercourse should be avoided until bleeding is stopped and you feel physically and emotionally ready. Some warning signs to report to your healthcare provider immediately are pain, redness, warmth, swelling, drainage, or foul-smelling discharge from the incision. Discharge from the vagina that has a bad odor. Severe headache or blurred vision or visual changes. Temperature over 100.4 or if you feel cold or feverish. Thoughts of harming yourself or your baby. Pain or burning sensation, redness, warmth, or swelling in the legs. Breasts that are painful, swollen, hot, tight, itchy, or have spots with redness, red streaks, and flu-like symptoms. Sharp pains in your abdomen, breast, or chest. Trouble breathing, dizziness, or faintness. Crying spells or mood swings that feel very out of control. If you're unable to empty your bladder or urination that is painful, difficult, or too frequent. If you're having difficulty having a bowel movement. If you need to report domestic violence abuse, you should call 1-800-96-ABUSE. So for your infant, I want to have some safety things first. For sleeping, you should place your infant on their back to sleep. Use sleep clothing such as a one-piece sleeper instead of a blanket. Do not let anyone smoke around your infant. Use a firm mattress and a safety-approved crib covered by a fitted sheet. Car seats and other sitting devices are not recommended for routine sleep. Do not use pillows, blankets, or pillow-like bumpers in your infant's sleep area. Wedges and positioners should not be used. Keep soft objects, stuffed toys, and loose bedding out of your infant's area. The baby should sleep in the same room as the parents, but not in the same bed. Avoid covering the infant's head or overheating. You should keep a bulb syringe near the infant at all times to clear the throat or nose if necessary, and clean it well with warm soapy water after each use and allow it to air dry. You should wash your hands prior to handling the neonate. All infants are required by law to be in a car seat while the car is in motion. Children should be placed in a child safety seat according to your state laws. The use of outdoor announcements is not recommended to announce the birth because they can call attention to the presence of a new infant. Question any unfamiliar person visiting your home or inquiring about your baby after discharge. Do not use home monitors or commercial devices marketed to reduce the risk of SIDS. Crying is a normal response for your infant. The most likely causes are hunger, need for a diaper change, or needing to burp. You should burp your baby after each feed. Some calming techniques include feeding your infant, changing the diaper, gently rubbing the back or tummy, walking with your infant, rocking your infant, skin to skin, or giving your baby a pacifier. It is never okay to shake your infant. If you get frustrated or angry, put your infant in a safe place, take a break, and call a friend. Infants do require a lot of sleep. You should be waking your baby at least every 3 to 4 hours for feedings. You should place your baby on his or her tummy each day for supervised tummy time, which will help strengthen his or her neck and abdomen. Your infant should be breastfeeding about 8 to 10 times a day per infant cues. You should be sure to hold your infant close to you while you're feeding. They need to be cuddled, and skin to skin is recommended. After feeding, hold your infant upright over your shoulder while gently patting or rubbing to burp. If your neonate is receiving a Similac or Enfamil diet for formula, if your baby is sleeping longer than 4 to 5 hours and misses feeding, awaken your baby to feed. Your infant will generally take 2 to 3 ounces per feeding after the first few days of life and will need to eat every 3 to 4 hours. Be sure to hold your infant close to you while feeding. They need to be cuddled. Never prop your infant's bottle to feed. Infants need to be burped every half an ounce of formula. After feeding, hold your infant upright over your shoulder while gently patting or rubbing his back to burp. Some newborn characteristics are a rash, and it's normal for your infant to develop a rash. It'll be small red circular areas with white dots in the middle. It does not require any treatment and generally resolves within the first week of life. You should avoid lotions, powders, and perfumed soaps. Milia are pearly white bumps that occur on the face, especially on the nose. They will disappear within the first week. And jaundice is also a very common occurrence. Your infant may appear to have a yellow coloring to his or her skin. It'll start in the face and progress down to the toes. If your baby appears to have more jaundice in the next 24 hours, you need to call your healthcare provider immediately. For bathing your infant, you'll need a sponge bath until the umbilical cord falls off. You should use a soft washcloth and plain water. Gently wash your infant's face. Bathe your infant from head to toe, saving the diaper area for last. Mild infant soap may be used on your infant's body. You want to keep the umbilical cord clean and dry. Cleanse with warm soap and water when soiled. Inspect the cord and surrounding skin with diaper changes and notify the pediatrician if drainage or discoloration is noted. The umbilical cord will fall off within 2 weeks. 1 to 2 wet or dried diapers are normal for the first day or 2 of life. Day 3 and 4 should have 3 fecal and wet diapers. Then you should expect to have 6 to 8 wet diapers of pale urine every day. Over the next few days, your infant's bowel movements will begin to change from a yellow-green to a mustard yellow and will soften in consistency. Your infant should have at least 1 bowel movement every 24 hours. You may want to keep a record of your infant's wet and dirty diapers to monitor adequate elimination and hydration. If you have a female baby, you should always wipe from front to back. Be sure to cleanse all creases and folds to prevent diaper rash, pat dry, and diaper. It is normal for baby girls to have a white or pinkish discharge. These secretions are normal and will gradually disappear. If you have an uncircumcised male, always wipe the baby from front to back. Be sure to cleanse all creases and folds to prevent diaper rash, pat dry, and diaper. And if you have a circumcised male, you should always wipe the baby from front to back. Be sure to cleanse all creases and folds to prevent diaper rash, pat dry, and diaper. Vaseline gauze is applied to the circumcision with every diaper change for about 24 hours. The head of the penis will appear red and then will change to have a yellowish sticky film. This is normal. If you see any bright red bleeding or green drainage, you should contact your healthcare provider. The plastic ring method of circumcision does not require a dressing, and it'll usually come off by 2 weeks. If you notice any swelling, bright red bleeding, or green drainage, you should contact your healthcare provider. To cleanse the area, wipe gently with a soft cloth, cotton swab, or gauze pad in plain water. Dress your infant as you would dress yourself. Avoid overdressing. Too much clothing and too many blankets can cause your baby to become overheated. and your infant should receive all the recommended vaccinations. Do you have any questions for me, Miss Clancy? I
don't.
know that was a lot. Here's your discharge packet. You can take that
Thank
home with
you.
you.
Thank you.
You're welcome.